Good morning, everybody. Thank you very much to the organizing committee and Paul Beaulé for inviting me to share my journey to a private practice setting in Canada. I'm a Canadian surgeon specialized in hip and knee replacement, full professor of surgery at Montreal University. I'm a senior clinical researcher from the Quebec Research Fund. I'm also the current ortho chair leader for Enhanced Recovery Canada and the founder and past president of the Personalized Arthroplasty Society. Unfortunately, I cannot be with you in person as I have the honor to be featured surgeon of the Practical Orthopedic meeting in Toulouse, France. I appreciate very much Dr. Beaulé's comprehension and willingness to keep my talk on his program. To prepare for the PCO meeting, Professor Reyna visited me at the Duval Clinic 2 months ago. We had a great time attending a Montreal Canadian hockey game, and he came to the clinic with a filming crew to capture the key elements of my new private practice. Let's see his arrival at the clinic.
Welcome, Professor Rena, to the Duval Clinic. It's a pleasure to welcome you here.
Thank you.
As you may know, the Duval Clinic is my main facility where I work for more than a year now full-time. I was an academic surgeon and working here part-time before.
Where do I come from? What are my goals? I'm an idealistic clinician. My career was oriented to offer the best care to my patients. The quest for the foregut joint and ERAS joint replacement were my main interest. Clinical research was a way to contribute and to evolve. My first 20 years of practice, I believe I was a respected clinician. I was professor of surgery, a recognized researcher with public fund, and many publications. I received multiple prestigious awards, but day after day, I was less and less motivated by my practice. Why was I losing my motivation? First, seeing pain and suffering without being able to do my job is probably the worst situation for a surgeon. I selected orthopedic surgery for its very high success rate. I was trained to cure people and to bring them back to quality of life. Being very idealistic, I always kept the patient at the center of my preoccupation. Unfortunately, it was not the case for many collaborators, anesthetists, and administrators. Fighting the system is very tiring, and after 20 years of effort, I had the feeling that I had to reinvent the wheel every 2-3 years. The turnover of the manpower in the public system prevents continuous progression. Dr. Simon Maltais, a cardiac surgeon, called this the healthcare disease. In his book, he explained how the healthcare system and the way we interface with it can create sick workers. One of my favorite authors as a teenager was Henri Laborit, a French scientist who explained the human reaction in front of a danger. There are 3 options. From the prehistoric era, the Cro-Magnon man in front of a mammoth had the choice to run, scientifically called sublimation. I did that a lot during my career, training as a cyclist to forget the bad working days. The second option is to fight the mammoth. I also did that a lot and work harder to change the system. Last option, the bad one, is to freeze and fall into inhibition of action in front of the beast. You become depressed. Henri Laborit was quite right with his mammoth theory. Even today, our Minister of Health calls the Quebec healthcare system a mammoth. In front of this mammoth, the most motivated person just abandoned the fight. The option I had was to retire, fall into depression, or to pursue my dream of being a helpful clinician. At 50 years old, I believe I still had much to do for the patients. I also wanted to show my teenage girls that I am a passionate worker. I decided to opt out of the public system and leave other people fighting the mammoth. Before sharing with you my experience in private, let's see how the Canadian healthcare system is built to better understand. The Canada Health Act is a federal legislation. It includes 5 principles: public administration, comprehensiveness, universality, portability, accessibility. To make it simple, a doctor cannot ask for out-of-pocket money for a publicly insured medical service. On the other hand, he's allowed to opt out of the system to perform private care. But insurances are not allowed to cover publicly insured medical service. And private hospital cannot keep patient over 24 hours. So performing major surgery was not possible until the Shaoli case. Dr. Shaoli and a 73 years old Georges Ziliotis, waiting for a hip replacement, prosecuted the Quebec government for prohibiting their right to offer or get appropriate care. In 2005, the Supreme Court of Canada stated that the Quebec government contravened the Charter of Human Rights and Freedom. So there was a change in the Quebec law, and it was allowing now the creation of private hospital and patient to get private insurance. There are two types of private hospital allowed in Quebec. They called CMS, one that has private-public partnership. In these center, the public system cover the cost of the service that the patient receive and the fee of the surgeon. They have no hospital beds for hospital length of stay above 24 hours. So only minor surgery are performed in these centers. Their profit are capped to about 10 to 15%. The second one is fully private CMS, where the patient must pay out of pocket the full amount of their care. Doctor working in these CMS must be out of the public system, and these center can have up to 5 hospital bed to keep the patient above 24 hours. The Duval Clinique was the first private CMS in 2008. One must know that a doctor cannot work in a private CMS and in the public system at the same time. I have worked part-time at the Duval Clinique since its creation in 2008. I was opting in and out of the public system about 2 months per year. In 2018-2019, Dr. Duval was looking to sell his business, but I was not considering myself a businessman. Affected by the healthcare disease, I was aiming to retire at 50 years old. But in 2020, during the COVID pandemic, all the pieces of the puzzle were assembled. One of my best friends, who is an administrator, became available along with 3 of my colleague surgeons. On February 1st, 2021, 5 partners, we bought the Duval Clinic, and such a move allows me now to reach my early goals to fully realize my potential as a clinician. We increased the volume from 250 cases to 1,200 cases, which required the increase of the workforce from 25 employees to 65. Having full control of the environment, I implemented an optimal ERAS episode of care, something I was not able to achieve in my public practice. After 2 years, I'm a happier clinician and do not think about retirement anymore. I do enough surgery, never have a cancellation. I remember my patient on the surgery day. I see my patient every day and enjoy the long discussion I have with them. I love my team. They are incredible people. I have full confidence in my team member. I develop my leadership quality as well. My patients do much better. The patient experience is a key factor. As a medical director of the clinic, I worked on some aspect I never expected to do. But the biggest difference is having full control of my practice. But I must tell, I never worked that hard and I miss a little the academics.
You, the surgeon, even if you are like managing everything, you are one piece and everyone is very, very important.
It is a paramount importance. After 20 years of practice, I mastered my surgical technique, and I understood that to improve patient outcome, to improve patient experience, I need that all my team members do their best, and we bring this collaboration together to create the real experience for the patient. What is the great advantage I have here in this private clinic is that my team are permanent. I have people seeing patient for hip and knee replacement every day. They become expert in each of them in their field.
But nothing is perfect. There are also some challenges. The patient needs to pay out of pocket the entire cost. This makes a little hard to take care of the complication in a private setup. Some complication cannot be taken care in private and we need to have access to a public facility. Human resources are also a real challenge in a small environment. Now, how do I see the future of healthcare in Canada? I believe that a public monopoly is not good for its improvement. The private option should be available to stimulate the public system to be better. If the public system offers appropriate care, the private system will disappear. Private facility like the Duval Clinic, offers services to taxpayer and relieve the public system. The government should reimburse a portion of the treatment cost. Orthopedic Institute exists in multiple countries. The 4 surgeons at the Duval Clinic perform 9% of the joint replacement of the whole Quebec province. I would like the Duval Clinic to become an example of efficiency and quality. Thank you very much for your attention. I wish you a great end of meeting, and I will do my best to be with you in person in 2 years.